Welcome to the Private GP podcast. I'm 𝐓𝐨𝐬𝐢𝐬 𝐖𝐞 CEO of Walk-in Clinic. One of our great privileges working where we work is our brilliant network of specialists. And today I am delighted to welcome Mr. Osama Naj, Consultant Gynaecologist at the Princess Grace Hospital. Thank you so much for joining us today.
Thank you very much, Alia, for your time and for having me today. I'm delighted to be with you.
It's really a privilege.
Thank you.
I understand that you've come immediately from this morning doing an emergency procedure that
Thank you very much. Yes, indeed. It was a little bit of a short stop before our meeting today.
Oh, well, we really appreciate you making time for us today.
Not at all. Thank you.
So one of the areas that, because we've talked before, I think, about how there are certain gynecological conditions where women maybe struggle to go from speaking to their GP to actually getting some action. So things like endometriosis is a really common one, where the latest research says that women on average see their NHS GP 10 times before they're referred on.
Yeah.
And in that time, their quality of life is affected and so many other things. And the other one where sometimes it can be difficult to get the care really in a quick way is fibroids. And I was delighted to learn that that's your specialism.
Thank you. Yes, we have a special interest in managing fibroids, both in the NHS and also privately. And so I hope the information we are going to discuss today to be found useful and informative to your audience and to your viewers as well.
I really hope so. I think it's so important for us as people who work in healthcare to cut through the noise.
Yes.
You know, social media is useful for so many things, but
Indeed.
It's also full of misinformation. And honestly, it breaks my heart that there are women out there who are dealing with something and not able to access clear information.
Yeah.
So I thought, shall we start with the basics today?
Absolutely.
Okay, amazing. Let's do it. So, what are fibroids?
I will tell you some brief background, but to give you a reference about some important topic you mentioned at the introduction, which is endometriosis. We are fortunate now that endometriosis is attracting a lot of public awareness. There is a lot of money, research, interest going into it to find some revolutionized treatments and cure for it. So hopefully we can have it on the horizon. And fibroids are way overlooked, and they much deserve, hopefully soon, the same level of attention and interest for it, because they are certainly commoner. It used to be, back in the old statistics and literature, used to affect 4 in 10 women.
Wow.
And now it is actually 7 in 10 women at least affected with fibroids.
What?
In their reproductive life, indeed. And simply because we are getting better at diagnosing them, and also because these fibroids, they develop at every age and every stage, and they are commonly troubling the women throughout their reproductive life, and mainly even after the, call it, post-reproductive time. Primarily, they are unexplained, benign tissue growth, belong primarily to the muscle layer of the uterus, but they tend to affect the reproductive health, the general health, and even gynecological health by 4 cardinal main symptoms. The mainly is heavy uterine bleeding, because they attract a lot of blood supply.
So women who are having heavy periods may well possibly have fibroids. Wow.
So that's why women who present to their GP, which is the commonest gynecological symptoms, irregular or heavy bleeding, please, my plea is try to, just my practice as well, I always invite patients to read about it rather than in the old days expecting probably the doctor to guide them or to explain everything. It's a level of empowering them at every age and every stage.
I love that.
So don't get the provider, the specialist, just to shut you down and tell you this is the fact. Go and read about it so you can be challenged as well on the facts to help you make an important decision.
I'd like to repeat that.
Yeah.
So empowering at every
stage and every age.
Every stage and every age. What a great mantra.
Thank you.
I love that.
And in fact, it's a basic fact that nobody knows your body better than you. So trust your judgment. If you believe this heavy bleeding is causing you a problem, then please try to seek more information and try to come to the bottom line of it.
Would you say that, obviously, as a woman, I'm very aware of some of the deficits in women's health. Would you say that with things like heavy bleeding or severe cramps or things like that, that historically, and this may be changing now, and it would be wonderful if it is, if in your opinion, but historically, women are sort of just told to grin and bear it a bit, like it's not life-threatening, so just get on with your life?
Big mistake, honestly, Natalia. It's very, very unfair. And in fact, until now, I see patients being told this. And I always say them, no, please, you need to say a very big no to this question or to this statement. You have to find out. It is not right. The menstrual cycle, it's a very finely orchestrated, and it is, let's call it probably structured to work in a very efficient way, like a computer system, and a regular, uneventful cycle. Yeah, not light, not heavy, not painful, not painless, associated with mild cramps. If you started to notice something outside this pattern, there must be something.
Wow.
Yeah.
What a message.
Yeah. Thank you. And back to the fibroids, they primarily heavy bleeding, but they cause other problems as well.
Okay.
And they could cause pain, pelvic pain, abdominal pain.
And does that feel different to
Absolutely.
a normal period pain?
Yeah. Absolutely, yeah. Totally different. And they could cause pressure symptoms as well. If you feel pressure on the bladder, if you feel pressure on the bowel, on any adjacent organs. I did have patients, unfortunately, who are having pressure symptoms on the kidney, and they ending up in renal failure when they have large fibroids, and they go on unnoticed as well. And also infertility.
Yeah.
So we are not making too big of a clinical drama about fibroids. Most of the fibroids may not cause these symptoms, but some fibroids they do. Some women they are troubled with the full spectrum of these symptoms, and some women they have some of them, and some of them they have none of them. And the idea is these symptoms all depends on three other factors: the number of these fibroids, the location in terms of the uterine structure, where are they located, and the size. So we call it together fibroid mapping.
Yeah.
So by knowing the fibroid mapping, every fibroid or every clinical story is its own merit, and we need to match the mapping of these fibroids to the clinical spectrum so that the right treatment can be planned, designed, and agreed as well. That's why the patient, the information, hopefully we are going to discuss today, your patients and your audience, they find them a little bit of an informative enough to seek the truth. Because unfortunately now we are living in an era where it's a little bit of too much information, we discussed that, but at the same time lack of reliable, solid information.
Yeah, absolutely. And I think what I'm really delighted about right now in what you're saying is, this push for women to demand investigation, to demand
absolutely
care when things sit outside normal.
Yeah.
And for us to redefine what is okay. Because I think, as I said before, I think a lot of women have lived their whole lives with severe periods, debilitating periods, and had very little input or very little support. And in some ways, I think because culturally, socially, there hasn't been this message, except in maybe recent years, some of them just won't even seek medical support in these circumstances, and they accept it as part of life.
Yeah.
And yes, I think it sounds like we both would love that to change.
100%. And Alia, also, like genetically proven evidence as well now. Women are brighter and stronger. But please don't take this pride. So because there's a family dependent on you, there is career dependent on you. So you are by the definition, at least running on 3-4 tabs open at the same time.
Absolutely.
And they're all dependent on you. So when it comes to your health, please seek the truth and don't delay it, and don't say that I'm able to put up with it, because even if you do, maybe your dependent or your loved ones would like you to be looked after yourself better.
Yeah, and really when you think about it, during her reproductive years, that's 25% of your time that you're suffering.
Yeah.
You know,
absolutely.
that's that's a week out of your month.
Yes.
So yeah, I totally endorse this message.
Yes.
So let's say I'm a woman, I don't know, in my 30s, and I am experiencing heavy bleeding. What's my next step? What do I do?
Please, the next step, if you notice your menstrual cycle is not something you are used to have, change in the pattern of it, then you have to acknowledge that this is a problem, or maybe a condition that I would like to find out about. So see your GP, seek specialist input. Please, before you go and see them as well, try and probably empower yourself with a little bit of knowledge, a little bit of information, so that at least you can go and challenge the provider. I believe I could be having this, I could be having, because you will be knowing better. And then after that, they may be needing for some investigations. And luckily, as we compare with endometriosis, fibroids share very close geographical, pathophysiological correlation with endometriosis.
Right.
So ideally, you need probably to start with a little bit form of pelvic imaging, and ultrasound scan is the main image modality of choice to help you to exclude or confirm fibroid.
Which is entirely painless as a procedure, isn't it?
Readily available, not invasive by the true meaning of it, and gives you reliable on the day of results whether these fibroids, if present, by how many, how big, where are they. You know.
So I've got that information, and let's say my fibroids are impacting me in various ways. What are my treatment options?
Yes. Now, because if you remember, we discussed every fibroid is a particular clinical story. So we have to match the clinical findings, but after the ultrasound, with the spectrum of the symptoms to tailor. But I could brief you about maybe doing nothing is an option. Just be aware of it, and which will follow a little bit of monitoring, because these fibroids, they tend to follow 30-30-30, we call it trend. Sometimes they stay as they are, sometimes they grow, and maybe actually a little less time, they can sometimes start to shrink slightly, particularly after the menopause, because they are estrogen dependent growth. So when
they're
the natural
to hormones,
exactly, yeah. So when the hormones start to have a little bit of a landing zone, the fibroids may surrender. But now it's also coming to some studies that the behavior of these fibroids may follow certain trends other than the natural resolution. But in terms of the treatment, so it depends whether do nothing, and there are some medical treatment now emerging. It all depends on what fibroids are causing the symptoms. But if you give you an example about, say, large size fibroids, in fact, impacting the general health in terms of heavy bleeding, pain, and pressure symptoms. These fibroids are, by definition, probably indicated to be removed. And removing them, again, depends on the clinical circumstances of the patient, on her surgical history, and what is the desired symptoms resolution after removing them. Reproductive potential as well, whether the family is planned, is desired, whether family is complete or not complete. So it's different parameters. But if we suppose agree or think that surgical treatment is needed, then I'll give you a little bit of a historic background about, we call it a procedure called myomectomy. Myomectomy is a definition for surgical removal of fibroids, provided the fibroids have exhausted the medical or conservative or non-invasive treatment, that's supposed to be surgical removal is the best. The first myomectomy was done in the probably end of 19th century, around 1892, 1891, and things evolved dramatically after that. Traditionally, it used to be by an open cut procedure, which follows a lot of surgical morbidities, inconvenience, prolonged hospital stay, pain as well, and the recovery is not up to the satisfaction of it. So therefore, patients will be taken away from her environment, from her home, from her family for a little longer time in order to produce. They will recover eventually, but things moved on as well. The minimal access come to manage these fibroids in around probably early 70s, mid 70s, 1970s. However, they introduced, we call it laparoscopic myomectomy, which is by minimal access procedure. But this procedure
is that keyhole?
Keyhole, indeed, yes. It's a hugely labor intensive. So, and in the end of the day, when you invest in the surgeon's capability, ultimately it will end into a better surgical outcomes. Yeah. So it's been tried in the since the 70s and been successful. But they have done, not long ago actually, a survey among all the UK gynecologists about their uptake between the open myomectomy or keyhole myomectomy, and only they found 15 to 20% they do minimal access, because it is heavily, it needs a lot of surgical dissection, it needs a lot of suturing, right. And subsequently it needs a lot of other medications to help the fibroid to shrink. So it's not very it did not fulfill its full potential. Let's put it this way.
I was reading recently as well about advancements in robotic surgery for this.
Absolutely, yes. So I'm glad that you brought this subject, yeah. Because the robotic technology has revolutionized fibroid care, and because it made a very successful transition straight away from open approach with all its disadvantages into a minimal access approach, but on a very advanced technology that is performed first time, I think, around 2000, 2001. And this has generally revolutionized the care on every aspect. And I will name you a few, because the picture with the robotic technology is 10 times better than the normal.
Wow.
The robotic hands, it actually has more manual dexterity than the normal human hand. And the 3D visualization of the surgical feed, you are your own assistants, and you are sitting on a surgical console rather than standing up with a less shoulder strain. So my point is, when you invest in a comfortable surgical environment to the surgeon, you're guaranteed a better surgical outcome.
And that's so hopeful for so many women that this advancement has taken place. And what does that do to recovery time?
Indeed, yes. So now, because the minimal access surgery, so the patients will be needing a lot less hospital stay and back to their family a lot quicker, and also back to their normal life a lot quicker. Patients we have seen and treated going, in fact, I have a little bit wanted to have a Hindu in Spain in a week time. She said, if you guarantee it, I said, we'll try our best.
Priorities.
And she's managed actually.
That's incredible.
To do in a week. For a holiday in a week time.
Honestly, that is such a message of hope. Yeah. I mean, I hope our listeners are filled with some, real optimism to hear that you can deal with a really life-altering condition like fibroids and be back on your feet in a week. That's incredible advancement. That's wonderful.
And thanks to the technology, of course, and thanks to, because unfortunately now, when we're talking about this technology, hopefully it will be, we had a little bit on the briefing, me and you, before our interview about the NHS. And this technology started to become slightly introduced to the NHS, but I have to say it's postcode lottery. It depends where you are based. It's not universally available. But luckily, HCA, the pioneers for advancement in surgical technology, so they are one of the very forefronts to be adopting this surgical technology and looking after their consultants, training them, proctoring them, and for the benefit of their patients. And we have several of success stories on that front. So it is, like you said, generally life-changing, this type of treatment.
Well, what an optimistic future we
Indeed,
have.
indeed.
And I'm so happy to have had this opportunity to hear from you on this. And thank you for all your work supporting women with their health.
Thank you very much.
And your dedication to, improving their lives. So thank you so much.
Thanks a lot.
And I hope we get to talk soon again.
Absolutely, Anya. Thank you very much for having me today.
Thank you.
Many thanks.